My name is Greg Zarcone, and I'm an internist at the CHRISTUS Trinity Clinic. I'm originally from New York State, in particular upstate New York. I was born in New York City and raised upstate New York. It was terrific. I was a son of a local family practitioner in a small town and had the benefits of country living and got to experience medicine through my father and then my sister, who became an internist after him. I'd probably say that my sister has the biggest influence on me, both personally and professionally, being able to train with her and watch her as she went through college and medical school and then also started her practice, and I had the opportunity to be a part of her practice as a student, as a resident, and so I learned a great deal from her. A big influence was my father at the time, since he was a family practitioner and I grew up in that type of situation. Over time, when I was younger, I also helped start a youth ambulance corps, and so I was involved with EMS and their training. And so I've always been involved in medicine, probably since the time I was a child and then into my teenage years, and I enjoyed science, and so it was a great way to put the two together, and I enjoyed helping people, so honestly it seemed like the optimal profession for me. I love the breadth of the specialty. There's not anything in internal medicine that you just don't have some type of knowledge about, so you really touch upon every subspecialty and you get to know so many things about so many different disorders and get to apply that to your patient on an everyday basis, because your patient is complex. They're not just heart disease or they're not just diabetes. They're a compilation of those diseases plus who they are as people. And so internal medicine treats, you have the opportunity to treat that whole person and not just part of that person. And that makes it not only interesting, but intellectually satisfying as well as professionally fulfilling. I try to take a really a holistic approach to patient care, understanding not only the patient, but the dynamics of their life and their diseases as well, and how they change over time and how they become sort of the interplay that they have together and the effect on that patient. And so that's really affected how I treat patients and how I look at patients, and I try to treat patients like individual people, just like I would treat anybody I would be talking to. And so, and I try to enlist them in a partnership or relationship with me, so it's not just me telling them what to do, but it's me explaining to them what I think is the best for them, and hopefully enlisting them into that relationship that they're going to want to do the best for themselves.